Hi everyone, and welcome to today's WALPEN webinar. I'm Marcy Hubbs, the manager of Well Ahead Louisiana's Provider Education Network, or what we call WALPEN. Thank you so much for joining us today. We bring you today's webinar regarding medication therapy management, and we have Raven Jackson, who is very well versed on the subject. She'll be presenting to us today. Raven holds a doctorate of pharmacy and is currently an assistant clinical professor at Xavier University School of Pharmacy. One of her notable courses that she teaches within this program is medication therapy management. Dr. Jackson also provides clinical care for the bariatric and diabetes medication management services at West Jefferson Medical Center. We are honored to have an expert in the field sharing this valuable information and her experience with us. I now turn the presentation over to Dr. Raven Jackson.
Thank you so much. I appreciate it. I am so pleased to be providing this information to you guys. Medication therapy management has been something that is quite important to me and very important to our patients, and it is necessary that we are most equipped to provide this care from a pharmacy standpoint. Today I'm going to talk about making MTM work in community pharmacy, and I'm going to cover a couple different objectives. Some things are going to be very cut and dry, kind of like it is what it is, and other things are going to be based off of some experiences that I've had. I've worked with MTM in a variety of different sectors. After completing my doctorate of pharmacy, I moved to Indiana and worked with Walgreens in Indianapolis. I worked with a certain area there to help them improve upon their medication therapy management services, and I've worked with it as a manager with Walgreens, and then now teaching the course and training students. I've learned a great deal, so I do think it's important to share some of those personal experiences as well. So I'm going to jump right into the presentation objectives. Today I'm going to define MTM and discuss how it differs from terms that we all know, such as counseling and disease state management. I'm also going to discuss background regarding Part D MTM services and kind of how Part D plays a huge role in MTM. I'm going to also evaluate the differences between what's known as CMRs and TMRs and review techniques for effective patient encounters. I'm going to wrap up by discussing some strategies for a successful MTM program implementation, and that's really where I'm going to give you some of the experiences that I've had and what I've seen work at some other stores. And then lastly, we'll illustrate some methods of developing some non-Part D MTM programs, and we'll talk a little bit more about that. Oops. All right, so firstly, just distinguishing MTM from, again, those common terms that we hear all the time, disease state management and counseling. Disease state management is very focused on the actual disease state. So you may have, you may be providing information or education regarding diabetes or hypertension or hyperlipidemia, but it's very segmented to that disease state. And then there's counseling, which is usually at a point of sale, and it's usually regarding maybe one product, or you may provide counseling on more than one particular product, but it's not looking at the patient's whole profile. MTM kind of combines both disease state management and counseling, but it looks at it from a more holistic standpoint. So it's typically seen as the most comprehensive form of providing patient information. The Medicare Modernization Act of 2003, also known as MMA, requires that Part D sponsors have an established MTM program. What that means is that Part D plans, those insurance plans that provide Part D services to patients over the age of 65, they have to have an established MTM program. And that program must ensure optimum therapeutic outcomes for targeted beneficiaries. So for those patients who are targeted through improved medication use. So the overall goal is to make sure that patients are using their medications appropriately. The program must also reduce the risk of adverse events. So a lot of the times when we're looking at different MTM opportunities, we're trying to see, is this patient having an adverse event, or how might I mitigate an adverse event from occurring? And then the program must also be developed in cooperation with licensed and practicing pharmacists and physicians. So again, just who's able to provide these services and who are our key players in MTM. So again, just remember this at the back of your mind, that MTM programs are required to be a part of Part D plans. So CMS also has additional requirements for those MTM providers, or those people who provide MTM services. When providing MTM services, so for instance, if I'm working in a pharmacy and I'm providing MTM, there's going to be certain things that I'm able to do per CMS if I'm working with a Part D plan. There are interventions for beneficiaries and providers. Comprehensive medication reviews are a part of it as well, and then TMRs. So CMS requires that MTM providers provide interventions, annual CMRs, and quarterly targeted medication reviews. Interventions are usually targeted to specific medication-related problems. So like dose too high, dose too low, needs new therapy, Beers criteria, things like that. So they're usually very specific to an intervention that the insurance company has kind of already made, and we just have to go in and kind of access that claim. All MTM providers should be providing an annual comprehensive medication review, also known as a CMR. And this is usually pretty lengthy, usually 1 hour for completion. Quarterly targeted medication reviews with follow-up if necessary. These are usually your shorter reviews, and they generally occur after a CMR. When considering how to implement or incorporate MTM into workflow, there are a couple different things that we should think of. How we actually incorporate it can look differently depending on how your pharmacy is set up or who you have working at during a particular shift. But the 3 tenets that I find to be most important to make sure we have worked through all of the kinks are technology, synchronization, and staff. Technology is super important because when you're able to effectively use your MTM portal, it allows you to have a better grasp of incorporating those services into your typical day-to-day. Technology can always hurt you or help you. So if you aren't as well versed as like how to navigate through your specific MTM portal, then you may miss out on some claims, or you may not be able to easily integrate it into your workflow. Synchronization is also important. For some people, depending on, again, where you work, the MTM portal might be able to be linked with the regular dispensing or verification portal, which is great because that allows you to skip a couple steps. So instead of having to log in to verify and then log out and then log in to get to your MTM portal, oftentimes those things can be synced into one. And then also considering the impact of point of sale. Is there something that you can do to identify, at point of sale, like, hey, this person also has an opportunity for MTM. Can you put a sticker on a bag or a note on the bag or a star or something to help the technician or whomever might be checking that person out to say, hey, can you step over to the pharmacist's consultation window? They want to speak to you for a few seconds. And then lastly, staff. Training all pharmacists is super important. Utilizing technicians and students as best you can. Scheduling CMRs, obtaining background information. You can use them for a series of things. I'm sorry, I'm gonna have to stop. Hello? 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 Marcy? Hello?
I'm sorry, I was on mute. I'm sorry.
That's okay. That's okay. I don't know my phone. I don't know how to turn my text messages off on my computer. I've never had this happen before.
Oh, it's coming through your computer?
Yeah, and I don't know if they could hear it or not. And it happened like 4 times.
I hear the ding, yeah. I wonder.
I want to see if I can maybe mute it. I hate that I would have to start over, but would that be?
No, I don't. Yeah, I don't mind if you don't mind doing that.
I don't mind. I don't want it to be.
Okay.
Stinky. I wonder if I hide it or. I'm
Is
like,
it through your phone?
it's not, it's through my, yeah.
Like, can you turn the settings on your phone off so it won't come
Well,
through your computer?
it's coming through my computer. I wonder if I hide it. I don't know. Let me see if there's a way for me to, if I quit it, options. I'm gonna just quit it. Maybe it'll go away.
I mean, can you change a setting on your phone, like where it,
Oh, well, it doesn't push from my phone. It's just that it's,
oh,
the whole Mac thing. It's everything's in one almost.
okay.
Let me maybe just try to send a text to myself and see if it goes through. I'm so sorry.
No, you're good. Check. He's in the back.
Just keep the water open for like some minutes.
Okay. Okay, are you there? I'm sorry. Someone was at the door.
You're fine.
Hold on just a second. I know, it's like working from home. So all kinds of fun, huh? Surprises.
Ugh. And I literally never had this. Like, who's texting me right now? I'm just trying to see if trying to get somebody to text me to see if it'll go through.
Go, Allie. Go this way. Okay, sorry about that. Sorry on this end. Okay, so you want to start it over?
Yeah, I'm just trying to see one thing to see if I can.
I'm gonna, let's see, I think I can do this. I can stop. I can't stop the recording. Oh, I can stop the recording. Stop the recording. Oh, wait.
Oh my goodness, when I need people to text me, they can't text me.
Okay, look, let me try. I think I have your number. I'll try that. Okay, let's see.
This thing is crazy. Okay, well.
Did that come through?
Okay, they came through on my phone, but not on my computer, so we're good to go.
Yeah, I was like, I didn't hear the same ding that I heard before.
Fantastic.
So
Okay.
Okay, I'm gonna restart the recording.
All right. Thank you.
No, wrong. Okay. Hi, everyone, and welcome to today's WALPEN webinar. I'm Marcy Hubbs, manager of Well Ahead Louisiana's Provider Education Network, or what we call WALPEN. Thank you so much for joining us today. Today, we bring you the webinar regarding medication therapy management, and we have Dr. Raven Jackson, very well versed on the subject, presenting for us today. Raven holds a doctorate of pharmacy and is currently an assistant clinical professor at Xavier University School of Pharmacy. One of her notable courses that she teaches within, should we start over?
We can, yeah, that's fine.
Okay, I wasn't thinking that the screen wasn't up.
Mm-hmm.
All right.
Okay.
There it is.
Well, I'm glad we did. Okay, let me just try to, I tried to cancel the darn thing. Okay, how do
I wonder if it's just certain.
shut them off? Quit messages. I'm trying to just quit it. Okay. Okay, we should be fine.
All right.
I just took it off my dashboard altogether.
Okay. All right. Let me restart this. Hi, everyone, and welcome to today's WALPIN webinar. I'm Marcy Hubbs, the manager of Well Ahead Louisiana's Provider Education Network, or what we call WALPIN. Thank you so much for joining us today. Today, we are bringing you a webinar regarding medication therapy management, and we have Dr. Raven Jackson, who is very well versed on the subject, presenting for us today. Raven holds a doctorate of pharmacy and is currently an assistant clinical professor at Xavier University School of Pharmacy. One of her notable courses that she teaches within this program is medication therapy management. Dr. Jackson also provides clinical care for the bariatric and diabetes medication management services at West Jefferson Medical Center. We are honored to have an expert in the field sharing this valuable information and her experience with us. I now turn the presentation over to Dr. Raven Jackson.
Thank you so much for the introduction. I'm definitely happy to be providing this information to you guys. Medication therapy management has been a huge part of my life, my career. Since graduating pharmacy school, I was able to obtain some additional training and certification in medication therapy management post-graduation. And I've worked with it in various different fields, from being a pharmacy resident to being a pharmacy manager, and now as a pharmacy instructor. So again, very happy to be providing this information to you all. Today, I'm going to present information regarding making MTM work in a community pharmacy setting. My objectives for today are some are going to be very just factual, kind of cut and dry, and other elements will be based off of personal experiences that I've had or things that have helped me in regards to incorporating MTM. First, I'm going to help define MTM and discuss how it differs from counseling and disease state management. Then I'm going to discuss the background regarding Part D and how it has become a part of MTM services. Then I'm going to evaluate differences between what's known as CMRs and TMRs, which are basic MTM terms. And I'm also going to review techniques for effective patient encounters. Lastly, we're going to wrap up by discussing some strategies for a successful MTM program implementation. And this is when I'm going to really give some of the experiential things that I've learned from my different paths in pharmacy. And then lastly, we'll wrap up by illustrating some methods of developing non-Part D MTM programs. So what is medication therapy management? If I were to think about MTM, and again, how it differs from some of those terms that we know pretty well, such as disease state management and counseling, I first like to think of it from a smaller scale to a larger scale. Counseling is very product focused. So imagine that you are at a point of sale and you're talking to a patient and they're picking up amlodipine for the first time. You may counsel them on side effects, how to take the medication, so forth and so on, but you're not addressing their disease or looking at all of their medications. Looking at it from a little bit of a larger scope, if you were to sit down with the patient and say, hey, see, I'm going to talk to you about hypertension, that would be more so disease management. MTM is very comprehensive in that it incorporates all of those elements and more, and really looks at the patient's profile from a holistic standpoint. When we think about MTM and kind of how it's come about, Part D is a very big contributor to the success and the expansion of MTM. The Medicare Modernization Act of 2003 required or put in place that Part D sponsors or Part D plans that they must have an established MTM program. And those programs should ensure optimum therapeutic outcomes for targeted beneficiaries, so those people who are eligible for Part D plans, through improved medication use. The program should also reduce the risk of adverse events. And the program should be developed in cooperation with licensed and practicing pharmacists and physicians. So again, those key players, those stakeholders in MTM implementation. CMS has several requirements for those Part D plans. So in order for a plan to get a check from CMS, a check mark from CMS stating, hey, you're doing this right, they must identify beneficiaries who are MTM eligible. And in order for a person to be eligible for MTM services, they must have three things. And these three things, these are three large categories. The categories stay consistent, but the number of each kind of changes from year to year. So a patient must have multiple chronic diseases, whatever those chronic diseases are for each particular year. The beneficiary must be taking multiple Part D drugs, and that can change from plan to plan. Some plans might require that a patient be on 6 drugs. Some might require that a patient be on 8 drugs. So again, that has some variance, but they should be on a certain number of Part D drugs. And they should be likely to incur annual costs for covered Part D drugs that exceed a predetermined level. And these changes every year. So it can be it could vary. I know as the years have kind of come about, I've been looking at these numbers since 2016, and every year it's gone up a little bit. So not only are there requirements for MTM providers, there are also, not only are there requirements for Part D plans, there are also requirements for MTM providers. And these requirements are put in place so that we kind of know what to do when we're approaching a patient who is MTM eligible. There are 3 main categories. Those categories are interventions, annual CMRs, and quarterly TMRs. So I'm going to break down each one because all 3 are important components of what CMS requires of us. The first being interventions. So we should be looking at those specific medication-related problems like dose too high, dose too low, needs new therapy, Beers criteria, etc. Things like that that are specific to, again, a medication-related problem. That when you get an alert about interventions, those interventions, again, are going to be related to a specific medication-related problem. Annual comprehensive medication reviews are lengthy. They're about an hour long for completion, but that's that CMR that I mentioned earlier. And CMRs are a huge part of MTM for many different reasons, because that is the comprehensive piece that we speak of when we talk about MTM being comprehensive in nature. It's that review of all of the patient's information. And again, that can take a good amount of time, but that's also where we get most of our revenue from. Then there are quarterly targeted medication reviews, or TMRs. These TMRs are short reviews, and it's basically just a follow-up, generally following a CMR. So these are just some terms you may hear. If a patient is eligible for MTM, or if we're providing MTM services, they may be having an intervention, they may be having a CMR, or they may be having a TMR completed. When providing MTM services and incorporating MTM into workflow, there are 3 different things that we should always consider. Technology is a huge one, so is synchronization, as well as staff and staff training. Technology is always important because it can always hurt us or help us. If we are able to effectively utilize our MTM portals and be able to quickly navigate and identify opportunities, then we're more able to accurately incorporate this service into workflow. It becomes a little bit easier when we're more well-versed on how to navigate through some of those portals. Synchronization is also important. Consider, can your MTM portal be linked to your regular dispensing or verification portal? I know for some stores, they may be able to some kind of way merge those 2 services so that they're not having to log out of their verification system to check their MTM portal. So if you can skip some of those steps, it might be a little bit more easy for you to say, hey, you know, these claims are kind of popping up, as opposed to it being a second thought or something that you consider on top of your additional duties. And then consider the impact of point of sale. Is there a way for you to be able to flag or identify these patients when they're getting ready to check out if they have MTM opportunities? Staff training is important. All pharmacists should be trained. Also utilizing your technicians and students. I could have almost bolded that one because that can save you a ton of time. As a pharmacist, there are so many opportunities within providing MTM that can be delegated to your technicians and your students. So use them if you have them. Your techs and your students can obtain background information from your patient. They can schedule CMRs. They can help manage the MTM portal. And they can also submit documentation and help with billing. So that really saves you, the pharmacist, time for just reviewing the patient's information talking to the patient and getting your thoughts together for developing your plan and communicating with the provider. Everything else, again, can be done by your texting your students, so utilize them. And then having a designated point person or point people, sometimes giving additional duties to a technician or a staff pharmacist will really help them to feel like they have a place at the store or at your location, and that they have an additional responsibility, and that can help increase morale as well. Some ways to improve MTM effectiveness. Now, these are some things that I have learned just as I have worked with MTM over time and have talked to other pharmacists and technicians who've worked with MTM. Some things that help you get the most bang for your buck, or really help you with your time, is dedicating and blocking off set days and times for CMRs outside of the daily pharmacy workflow. So can you schedule 45 or 60-minute time limits for each CMR? Do you have the capability of putting that much time aside? Why? Because that's about how much time you would need to effectively do a CMR. You would want to make sure you have time to review the patient's information, schedule time to see them, and document, because you always want to document as close to the time of the CMR session as you can. Reviewing a patient's medication profile before the CMR session is, again, always very helpful. Requesting that a patient bring his or her latest diagnostic lab results is something that has helped me tremendously. We can request that information be sent to us from the doctor's office, but that can sometimes take a long time. So it's often good if we ask the patient, hey, can you, if you want to drop them off before your visit, or if you want to bring them into your visit, come a little bit earlier so you have time to actually review those labs. It really helps for you to understand how the medications are working when you also have those lab values. It's really hard to discern when you're just looking at adherence or pickup times and you don't have those lab values. Identifying potential additional clinical service opportunities that could be presented to the patient during the CMR session. So can you add on any additional services, such as point of care testing, something that you can bill for on top of the CMR? Because depending on your MTM portal, for instance, like Outcomes or some of the other platforms that exist, you may be able to add on additional services and gain reimbursement from those as well. Following an established protocol for informing physicians and prescribers of identified drug therapy problems is critical, because once you have that framework, you're really just plugging in specific information for certain doctors. So you don't have to rewrite that letter for each provider. You kind of have the framework, and then you're including that provider-specific and patient-specific information each time. And then following an established agenda for each CMR session. So having a framework of, this is what I'm going to do each time I sit and engage with a patient, it helps you to understand and to have a better workflow in regards to what you're going to do, so you're not kind of scrambling when you get into the room with the patient. There are certain core elements of MTM that you should be aware of, especially when you're talking about completing a CMR. And I've said CMRs a lot. CMRs are super important. Again, there are other components that CMS requires, but those annual CMRs, what each target beneficiary should have provided to them, is where we really do the meat of our reviews with the patients. So there are a set of core elements, and that's that framework that I was talking about on the previous slide. Medication therapy review is one portion of it, and that's when the pharmacist is reviewing the medications, both OTC and prescription, development of problem list. The personal medication record is a consolidated list of medications after reconciliation. So you would first do your medication therapy review, then you would talk to the patient, they would bring in their meds, you would look at what your computer system has, and then you would try to reconcile and say, hey, is there anything here that is not matching what's in the system? Or is there anything that's a duplicate or something that shouldn't be there? And then there's a medication-related action plan. These are action steps for the patient to continue. So what do you want to leave with the patient? What is their responsibility in improving their health? And then there's an intervention and a referral. And these are the action steps for the pharmacist to complete. So like contacting the provider for a drug change, And then of course there's documentation and follow-up where we're doing billing and then mailing anything that needs to go to the patient if it's not given to them during the visit. When we consider the interaction with the patient and whether this is over the phone or in person, whether this is for a CMR or a TMR, even for something short like an intervention, we want to think about how we are interacting with patients. And motivational interviewing is a huge piece. It's something that we all know about as pharmacists. We are able to collaborate with the patient for joint decision making. Motivational interviewing is really giving the onus to the patient where they have that internal motivation where they say, this is why I want to make a change. The responsibility lies with them. They develop their action plan and we just kind of assist them at getting to where we know they need to be. There is a rule principle that is tied into motivational interviewing, and that principle is to resist the urge to write the patient. That's the first step. And what that means is we know what's quote unquote correct or what should be proper or appropriate, but we have to not try to wag our fingers at the patient and saying, no, you're doing this wrong, you should be doing this. Our goal is to help them get to that clarity just by communicating with them. Understand the patient's own motivations. What might motivate you may not motivate them. If someone is trying to quit smoking and they're motivated by the fact that their daughter's wedding is coming up in a year and they don't want to smoke for the wedding, then that's something that they want to work towards. So that's their own motivation. Listen with empathy. Sometimes, again, it's hard to understand where someone's coming from, but at least try to hear their side of the story. And then always, always, always empower the patient. If nothing else, that's one thing that I always try to even encourage my students or my technicians, whomever I'm working with. Always give the patients a kudos for whatever they're doing that is already correct. No matter how small you might think it is, it makes a huge difference with them getting that congratulations or that good job. It really helps them to continue making good decisions moving forward. There's also the teach back method, which is very easy, and I think we use it all the time, and we sometimes don't put a label to it, but talking to the patient, providing them with information and then saying, hey, just in case I may have missed something, do you mind repeating that back to me? So it has a twofold method. It really helps you to understand if the patient knows what it is that you just told them. And it really does give you a good double check. Sometimes we get so scripted and we may forget to say something. So if a patient is repeating something back and they're missing something that's big, you might say, oh, I forgot to mention, so forth and so on. And then utilize open-ended questions as well as closed-ended questions. I know that we are sometimes taught closed-ended, yes, no, that's all we need, but sometimes we need the dialogue as well. So don't forget to utilize and be open to those open-ended questions as well as closed-ended questions. And they both can be beneficial. All right. So now I'm going to move on to talking about some non-Part D plans, Part D MTM programs. So we just spoke a lot about Part D and what Part D requires. So Part D has the certain requirements for Part D plans, such as a target beneficiary should have a certain number of disease states, a certain number of drugs. They should incur a certain cost for their covered drugs. And then there are certain requirements for those people who are providing MTM for those patients who are target beneficiaries of Part D plans. So we should provide certain interventions and CMRs and TMRs. But there are also some non-Part D MTM programs that can exist as well. So we don't have to just provide MTM services to Part D eligible patients. We can have some unique billing opportunities in other ways. So state Medicaid, which is still would fall under CMS, but it's not Medicare. There are some Medicaid eligible patients as well. And then there are some private non-traditional ways of providing MTM programs through traditional insured groups, managed care groups, self-insured employers, and self-paying individual patients as well. When you're creating an MTM service model and you're trying to start your own MTM program at your location, when you're selecting the services to offer, you want to consider what are the healthcare needs of people in your pharmacy and people in your community. And then what are the needs of healthcare providers in your community? Do you know any doctors? Are they looking for any additional medication reconciliation or medication management support? And could you potentially partner with them? What are the needs of payers? If you know any small local plans, what are they working towards, or what are they in need of? What are the goals of your service? Do you want to improve medication adherence, patient satisfaction, some clinical endpoints, reduce costs? Having a set goal in mind really helps you to establish your program early on so that people know exactly what it is that you do. Pharmacist training and expertise in various clinical and communication issues. Whether to begin by offering a subset of all Envision services. So do you want to start small and then go larger? Or do you want to just provide multiple different services when you start? And then consider current payer opportunities. And what I mean by that is identify who might you partner with so that you have patients, or that you have people who come to you in need of MTM. It's going to be pretty hard to just, once you're checking people out, say, hey, do you want MTM? Hey, do you want MTM? But if you have someone who's referring those patients to you because they're saying, hey, you need to have this, then that helps you to have a constant flow of potential additional income. And partnering with self-insured employers is a good way to start. There is a potential for success because self-insured employers, they pay for employees' health care directly. So they have a strong emphasis on how much healthcare costs because it directly impacts their employee health. So if if an employee is sick, then they have to miss work. If they miss work, that's lost productivity. But if we're able to include some additional health services like MTM, which help to decrease someone having an adverse event or help to decrease the number of sick days, then this could help with the productivity and a decreased healthcare costs for that particular self-insured employer. And there may be room for negotiating reimbursement as well with those employers. Appropriate patients for MTM services, if you're thinking, who might be a good person or what might be a good population of people to reach out to or to target this MTM service to. So anyone who's been transitioned from one care setting to another, or has had a prescription change, anyone who's receiving care from multiple prescribers, who takes 5 or more chronic meds, who has at least one chronic disease, anyone who has had lab values outside of the normal range, anyone who's demonstrated non-adherence to medication regimens, including underuse or overuse. And that's something we sometimes just think of overuse, but underuse is also very important. The issues of limited health literacy or cultural differences and require intensive communication. And that's another piece where we want to consider what are we providing to our patients in regards to those patients who may have some cultural differences. Are we providing cultural competency to the best of our abilities? And then when we want or need to reduce out-of-pocket costs, those patients might also be a good market because we want to say, hey, can this be removed? Can this be exchanged for something that's cheaper? And then, has a patient recently experienced an adverse event, medication or non-medication related, while providing care? So these are just some things that you want to consider, again, when you're trying to identify who might be a good population of people. Because again, those Part D plans, when you're working with those Part D plans, they're going to send those patients to you through whatever MTM portal you're working with. So whether that be outcomes, whether it be something else. But again, when you're trying to start your own plan, you have to identify where those potential beneficiaries or where those potential patients might be. So just a couple things to consider as we wrap up. Part D has set the framework for MTM, but there are opportunities outside of Part D that are endless. And especially if you're working more so in an independent pharmacy and you're able to kind of have a little bit more leniency with what you can do in regards to the implementation of services, this is really something you can think of. You can decide to create an idea for an MTM service. You can market it to maybe a small provider or a set of providers who may be interested in sending their patients your way. You can create how much it should cost or how much the service would be rendered. And you can market that service as something that you provide. And it doesn't have to go through a particular insurance company or a particular portal in order for you to get reimbursed. The patient can self-pay. Or you can work with the self-insured employer. If you know a small employer group, that group might be able to truly just reach out and say, hey, we're going to pay this much for you to see all of our patients. And that may be, again, another way for you to provide that care from a non-Part D standpoint. Utilize your entire team. Don't forget about your techs. Don't forget about your students. They hold a lot of weight and can really help to increase that productivity and incorporating MTM into workflow. When conducting a CMR, there is generally always another intervention that can be made. There's always something that needs to be done. So if you look through and you're like, oh no, this is perfectly fine, look through it again, comb through those medications again. When you have patients on multiple medications, the more medications they're on, the more likely there's something that can be done to help that patient have a better profile or help reconcile some issues that they may not even know exist. Even if it's just changing to a cost-effective alternative, you've helped that patient in some way. So always remember that there is an intervention that can be made. And then consider what you already have in place and try to make MTM work around that. You have to verify, you have to dispense, you have to fill. There are certain things you just have to do in your pharmacy. MTM isn't going away, so we definitely want to make it fit, but we want to make it fit in a way that works for each particular pharmacy. And that may not be whatever Joe's pharmacy does may not work for Phil's pharmacy. So just modify your workflow so that it works for you. And those are the main points that I wanted to cover. If you have any questions, please reach out to me. I'm always available via email at rjackso8@xula.edu. Again, it was a pleasure providing this information, and thank you so much for your time.
Thank you so much for sharing this information with us today, Raven. And like she mentioned, please reach out directly to her at that email address if you have any questions regarding any of the material she presented today. She'll be glad to assist you with that. So we want to thank you again for joining us for today's webinar. If you're interested in learning about other trainings available through WALPN, please visit our provider education section on www.walpen.org for other available trainings. And also always look out in your monthly newsletter for upcoming live trainings and other resources available through WALPN. Thank you so much for joining us. Have a great day.